Sheila Jackson Lee, representing the 18th Congressional District, a member of the Democratic Policy Steering Committee, recently appointed, a committee that is going to lead the Democratic caucus on policy and the issues that we have to address under this new administration. But I'm also a neighbor, a friend. I'm also a person who's been at the bed of dying people. 10, 20 years ago, it was those who were suffering from HIV/AIDS. They were afflicted, they got sick and sicker. They were in a hospital bed and then to hospice, and they died. That was their destiny. They died. Many died because they had no access to health care. Many died because we had not reached the level of research as we have done today to allow those who are infected to be able to live. Medical research and science is in a blessing, talented people of America. And I've come to understand with that experience, that no matter if you live in a trailer park, in a trailer home, if your house on the east or west or south side or north side has a gaping hole in the roof, if you barely are able to pay the rent on your apartment, or you had a great job, but you had a catastrophic illness, bankrupt, and have no ability to get the insurance that you need, there should be no unequalness when it comes to health care. Dr. Martin Luther King Jr. said there comes a time when one must take a position that is neither safe nor politic, nor popular, but he or she must take it because conscience tells him or her it is right. What I say to Republicans, take a position to save the Affordable Care Act that is not politic or safe. What I say to Democrats is don't be fearful of being isolated, castigated, rejected, called divisive if you are doing it out of the conscience of helping those who cannot help themselves. These are not my words. The media has investigated and researched 24 hours ago or more. Every Republican in the House, a few days earlier, every Republican in the Senate took a vote without conscience to repeal the Affordable Care Act. They had all kinds of excuses. They're going to get a plan. They're working on a plan. 6 years, they have no plan. They have repeal, but they have no replace. All they have is delay and destruction. But when I opened our local newspaper, there was no politic here. All it did was tell us a story about a woman by the name of Ann Bunting, who let me just say, you didn't read it, got a little ill and couldn't breathe, went to the doctor and said, you need a transplant. Doctor's advice. Not Sheila Jackson Lee, a member of Congress. Not you didn't counsel that she needed a transplant. Not the pastor or her faith leader. Not the teachers union. You didn't ask for her to have a transplant. This is what we saw time after time when we were trying to put this bill together. There would be witnesses who would come in tears. Her insurance company said, you don't need a transplant. We'll just give you a pacemaker. Doctor saying, I don't know if she can hang on. Oh, just give her 2. Doctor was scared. They went into surgery, put 2 in her. God help her, she managed to come out of surgery with 2 pacemakers in her. Not the council of doctors, but they had to do the best they could. She was an entrepreneur, small business owner, no other way. But lo and behold, a silver lining came in 2010. Come on. And as soon as the Affordable Care, Obamacare, thank you, Mr. President, was passed, let us dismiss the myth that we didn't try to work with Republicans. I was there. We opened the door to write the bill to them. Every amendment that messed it up passed, and because we allowed it to get in the bill. When they said you couldn't keep your insurance, that was a Republican amendment. But as soon as it passed, she was moved to the transplant list. The picture you see today is a woman who got a transplant, heart transplant, on the Affordable Care Act when the insurance company told her just a few years earlier, she couldn't get it. If she had to have waited much longer with 2 pacemakers, an unusual operation, she doesn't know, we don't know where she might be today. Does that look like someone who is against the Affordable Care Act? No. She's living today with a transplant. they were trying to hear all of the Republicans, somebody came up with a brilliant idea. What we want is a cheaper plan. You see, we want to get a bill that will allow people to buy a cheap plan. And the cheap plan will run them right to their grave. Because when you get a cheap plan, then the cheap plan is cheap. And when you get sick, your health care is cheap. And more than likely what they will say to you, take an aspirin and go home. You don't have hospital coverage, your doctor coverage is limited to preventative care, and frankly, we don't care. That's what cheap coverage means. We want to save the Affordable Care Act and give people a decent, healthy way of living. Demolishing of the Affordable Care Act will give billions to the insurance company and eliminate the tax subsidy that has helped working families. How do you think that really works? It will eliminate the hospital compensation that has been the anchor for rural hospitals in Texas. Without the Affordable Care Act, we will close the rural hospital system in Texas and throughout the South and throughout many other states. Rural hospitals depend upon the Affordable Care Act. Without the Affordable Care Act, the pre-existing condition exemption or elimination will be in the cybersphere. No one knows how will we recapture it if you take it out. If you end the mandate, you end the basis of the insurance companies to be in the program. And unless you're going to do a universal Medicare public option, why don't you tell us what you're going to do in your inaugural speech? Are you going to do the public option? Because if you're not and you're going to eliminate the mandate, you're going to eliminate the very basis of insurance companies, and I hate to say it, they are going to cut and run. If you don't have insurance companies in this effort, who do you have? And you will have a negative impact on Ben Tom, which has felt the diminishing lack of the Medicaid dollars that we gave to the state that has impacted their emergency rooms, and LBJ has lost beds because we did not have the expanded Medicaid. Good facilities with good doctors and nurses and health professionals being diminished because we didn't have the expanded Medicaid under the Affordable Care Act. Now the Republicans want to completely take our safety net so that we're not even free-falling, we're just coming down to our death. I, for one, and I hope you, as you stand here today, will be soldiers out in the spirit of Dr. Martin Luther King to help the beloved community. We are not going to allow the Affordable Care Act to be diminished, demolished, and destroyed on our name.